Let's say you're planning a trip out of the country and you want to know, if I come down with coronavirus, is my health insurance going to cover me? Okay, that's a fair question. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, let's talk about this. If you have original Medicare, you should know that you have essentially no coverage outside of the country. So it's a good idea to purchase a travel medical plan. And there is one that I recommend. There's got to be thousands of them out there. Don't just go looking for the one with the cheapest plan or the one that comes with your cruise ticket or your airline ticket or something like that. You really need to look at these things, even though hopefully you'll never need to use them. But if you do, you want to make sure it's a good one. Okay, we're going to talk about two things here. First off is pre-existing conditions. Most of the travel medical plans out there do not cover pre-existing conditions. If you come up with something new, okay, we'll cover that. But we're not going to cover pre-existing conditions. The GeoBlue plan, specifically the GeoBlue Voyager Choice plan, does cover pre-existing conditions. Only if, one, you have creditable coverage prior to going on the trip, and creditable coverage would include original Medicare. It does not include VA benefits or Medicaid, but if you have original Medicare, that is considered creditable coverage. So if you have Medicare and the GeoBlue Voyager Choice plan, then you've got coverage for pre-existing conditions. If you buy the GeoBlue Voyager Essential plan, which is a few dollars less, you have no pre-existing condition coverage. So chip in a few extra bucks. You're going on a trip somewhere, and hopefully you'll never need to use it, but pay a few extra and upgrade, if you will, to the Voyager Choice plan, not the Essential. The other thing is, and this question came to mind because of a real situation that's been in the news recently. There was a cruise ship that was, I don't remember where they were traveling, doesn't really make any difference. They were outside of the U.S. waters. And about 100 passengers on this ship were suspected to have contracted coronavirus. So, of course, they were quarantined. Well, what does the ship want to do? Well, they want to get rid of them. So they tried to find places, ports where they could put in, dock the ship and offload these passengers. And everybody says, we don't want them. You go somewhere else. So they did. They kind of cruised around for a few days, and then finally they found a port that said, okay, we'll take them, and we're going to take them from your quarantine over to our quarantine. All right. Most of the international travel medical plans you purchase for a specific period of time, 1 week, 2 weeks, 3 weeks, however long you think you're going to be gone. And the travel medical plans, most of them, when that period runs out, let's just say that you took out a 10-day policy. I'm going on a 10-day cruise. We're not riding with the skipper and Gilligan, so we should be back within 10 days as opposed to being on TV for 7 years. So you have this plan. Well, let's say that you have the Voyager Choice plan, the GeoBlue Voyager Choice plan, and I'm going to link to this in the description below this video. But let's say that you have the Voyager Choice plan and you bought a 10-day plan, and you're quarantined or you're sick for whatever reason. It doesn't make any difference. There's some kind of reason that's going to prevent you from returning back home within that 10-day window of your policy. So what happens? Well, if you had somebody else's plan, when the 10 days was up, the 10 days was up, and you have no medical coverage, that's not a good situation. With the GeoBlue Voyager Choice plan, you can contact the folks at GeoBlue and say, hey, I'm stuck on this ship, or I fell and broke my ankle, or, got shot, who knows. I mean, there's any kind of things that can happen. It doesn't have to be coronavirus. but I've got this problem, and I'm not going to be able to be back in the States within 10 days. Well, they say, that's okay. You've let us know. We'll extend your policy. How long do you want it extended? A week, 2 weeks, 3 weeks? Just let us know, and we can do that. I don't know of any other plan that does it. There may be some that do it, but I don't know of any other plan that gives you the extension. Others would say, okay, we'll write you a new policy, but, you've got a pre-existing condition clause and all this kind of stuff. So basically, it's kind of like, yeah, you're buying in case you get shot a second time. Or, you come down with who knows what, in addition to whatever ailed you to begin with. But the GeoBlue Voyager Choice plan does allow you to contact them as long as you do that before the policy runs out. And they will allow you to extend it, and no pre-existing would apply. They're not writing a new plan, they're merely extending the one that you have. It's a good thing to know. Just make sure that you remember it if this situation comes up. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.